For some other participants, it is not full screen, it seems. Please check with other participants. It's not full screen. Others?
I think, ma'am, they have to check it in their view, how they have selected the view option.
Others can view full screen. Can we get the response from
Yes,
in the chat?
yes,
Yes,
ma'am.
ma'am. We can view the full.
Full screen?
Yes.
Yeah.
Okay, we'll adjust ourselves then. Go ahead. But be careful in the Q&A session. You will take the live also considering.
Yes, ma'am.
And encourage in the live your Sahaya students, all of you be there in the live also. Some of you start live and watch live and get their questions to these people. Okay?
Yes, ma'am. Ma'am, shall we start?
Yes, yes.
Yeah. Awareness is like a sun, like the sun. When it shines on things, they are transformed. A very warm evening to all our lovely audience who have joined us today on a journey of awareness, strength, support, and transformation. I, Swatina Shashi, and my partner, Ms. Pramila Dugineni, counselors at Manojagrithi, welcome you all to the first day of the webinar series on psychological issues, triggers, and treatment.
A very happy evening to all the wonderful audience here. I, along with Ms. Swatina, once again welcome each one of you with warmth and gratitude for joining today's webinar. Before we begin, let us take a moment to calm ourselves, ground our minds, and seek positivity. To mark a sacred beginning, we invoke the blessings of the Almighty, the eternal source of wisdom, strength, and grace.
Manojagrithi. Manojagrithi is an organization consisting of a group of mental health professionals with a core belief that when there is harmony between the mind, heart, and resolution, then nothing is impossible. The organization works with a vision to spread mental health awareness, prevent mental health issues, and contribute to building a healthy nation with a value system. Sudisha is a counseling center, a unit of Manojagrithi.
It's my privilege to introduce the visionary minds behind this enriching webinar series. Dr. Geetha Challa, counseling psychologist and founder director of Manojagrithi, and Ms. Vijay Lakshmi, coordinator of Sahaya, the diploma course in counseling. We extend a warm and heartfelt welcome to both of you, and once again we welcome the wonderful audience for today. Request Geetha ma'am to share her valuable thoughts with us.
Yeah, thank you so much, Pramila and Swatina Shashi, for setting a very, very warm welcome and also the real good beginning for this series of webinars. So first and foremost, I should congratulate my students of batch 17 Sahaya who are conducting this series of webinars on psychological disorders trigger to treatment independently. I will be only addressing you people now for 2 minutes, then I am not in the scene, but I am there. So I am very proud and happy that within 6 months, they are proving themselves and feeling very happy and excited to listen to them as a student sitting, and as a participant I'll be here with you watching and listening to them. And about the series, this initiative of series of webinars almost for 21 days from today, and in Telugu and English, about all the psychological disorders. Most of them we are covering in this series of webinars. And if you are listening today in English, you will listen to the same thing in Telugu in the next 10. So why we chose this psychological disorders as the topic or of this series? Because I feel very sad, I feel very bad, and that, real frustration, and also feel low to be a psychologist. And coming to me, some of them tell me, ma'am, my wife is suffering for 16 years with this problem, and they don't even know the problem name. They don't know. For everything, they say depression only. So the awareness is very, very less, sometimes zero also. And they roam around different places, different hospitals, different settings, and come for therapy at the end. And there is so much of stigma attached, and lack of awareness, and hesitation to use medication. And there are so many myths around counseling. So, with this series of webinars, we thought of creating a very good and clear understanding about all the psychological disorders, and also speak about some triggers and treatment of the same. Once again, I welcome all of you to this series of webinars by Manojagrithi team, students of Sahaya 17, and looking forward to have a wonderful discussion at the end of each webinar. I'm always myself and Vijayalakshmi ma'am are available for you for any question. So just let us dive into the beautiful journey of series of webinars, starting with this orientation webinar. Over to the two dynamic and beautiful ladies, Swatina and Pramila. They both are wonderful, good understanding of concept, and they are very clear in their communication. You are very fortunate to listen to them today, and I will become participant right now. Thank you. Over to you.
Thank you so much, Geetha ma'am, for your humble words and your wishes. We also are trying our best to put our best in front of the audience. It's great. It's great to connect with all of you. We are excited to make this an interactive and learning experience where we can reflect, participate, and carry these insights in our studies, practices, and daily life. We work to bring harmony into people's lifestyles by spreading awareness on the creative, positive, and productive attitude towards life and offering evidence based approaches that empower individuals to face the challenges of life more enthusiastically and grow in all aspects of life.
So, my dear audience, we often carry the rush of the day with us, and this moment is an opportunity to gently let that go, to settle, to become present. Let us take a few moments to arrive fully into this space, not just with our bodies, but with our minds and hearts as well. Now, for a few minutes, myself and Swatina are going to take you to experience the relaxing and grounding techniques. Make yourself comfortable. Wherever you are, please make yourself comfortable. Are we all ready to experience the... Yeah, thank you so much for the response. Select calm, serene place without any disturbance. Sit in an upright position comfortably. Rest your hands on knees. Be relaxed and close your eyes. Now let us start with conscious breathing for 3 rounds. Just focus on your nostrils. Without any making effort, observe your breathe in and breathe out process. Another time, just observe the air that you inhale and observe the air that you exhale. Another last time, breathe in and breathe out. Continue keeping your eyes closed. Now let's experience the candle blowing technique. Now imagine a candle in front of you. Keep your hand on your stomach and take a deep breath through your nose until your belly bulges out like a balloon. When your belly is full, exhale through your mouth slowly as if you're blowing the candle at a distance. Let us repeat this process for another 2 times. Imagine a candle in front of you. Keep your hand on your stomach and take a deep breath through your nose until your belly bulges out like a balloon. When your belly is full, exhale through your mouth slowly as if you're blowing the candle at a distance. Another last time. Keep your hand on your stomach and take a deep breath through your nose until your belly bulges out like a balloon. When your belly is full, exhale through your mouth slowly as if you're blowing the candle at a distance. Relax, relax, relax. Now slowly come back to your normal rhythm of breathing and continue the same. Tell yourself, I am feeling relaxed. I am feeling more energetic.
We will now move ahead with the grounding technique, also known as the 5-4-3-2-1 grounding method. This technique helps in emotional regulation, improves focus and productivity, and encourages mindfulness. Let the next few moments be just for you, being mindful and non judgmental. Let us tap into our 5 senses one at a time. Continue to keep your eyes closed while we explore our 5 senses. We will begin by tapping into the sense of hearing. Notice or observe 5 sounds you can hear around you. Perhaps your own breathing, some bird at a distance, or even the humming of the fan. Let each sound anchor you gently into the now. Do not judge or interpret the sounds. Just listen. Feel each sensation fully. Let it remind you are here in this moment. Now, gently shift your attention to your sense of touch. While keeping your eyes closed, try to feel 4 things around you that you can touch and feel. Maybe the weight of your body on the chair that you're sitting on, the cool air on your skin, or even the way your feet presses into the ground. Do not judge the feeling, just observe. Feel each sensation fully. Let it remind you are here in this moment. Turning to your next sense, the sense of smell. Try to notice 3 smells around you. Maybe the scent of the room or the perfume you have used, or even the absence of smell. If you can't experience any smell, that's okay. Just notice what's there or recall a favorite scent in your memory. Feel each sensation fully and let it remind you you are here in this moment. Slowly rub your palms till they are warm and then place them on your eyes gently. Feel the warmth of your palm, and once you're ready, slowly open your eyes. We now tap into the sense of sight. Look around you and notice two things that you can see. They don't have to be special, just observe. Perhaps a beam of light, the shape of your hand, or even the color of something near you. Just observe, do not judge. Feel each sensation fully and let it remind you you are here in this moment. Let us gently tap into the last sense, the sense of taste. The candy that you have brought for today's session, I request you to take that in your hand while you keep your eyes open. Take the candy in your palm and observe its shape, color, and texture. Do not judge the candy, just observe. If the candy is one which has a wrapper, unwrap it and try to pay attention to every minute sound and sense that it activates. Smell the candy. Bring your palm near your nose and smell the candy. And observe if your mouth is watering. Now slowly place the candy on your tongue, but do not bite it yet. Let it sit there for a while. Feel its surface. Observe the way it brings taste, sweet or sour. Observe it. Let it dwell around all the corners of your mouth while observing all the senses that it activates. Now, slowly and mindfully chew it and follow the entire journey of that candy into your mouth until it disappears and is swallowed down. Just observe its journey. Do not judge the candy. Observe the taste. Observe the bite. Be mindful about the sense. that you are focusing on, the sense of taste. Once you swallow down the chocolate or the candy, take one final slow, deep breath in, and as you exhale, feel your body settle fully into the now. Feel the sensation fully. Let it remind you are here in this moment. You all have just grounded yourself. You are present, you are safe, you are calm, you are focused. When you feel ready, gently wiggle your fingers and toes and bring yourself back into the room, aware, steady, and at ease. May minds be open to new ideas, hearts open to understanding, and spirits open to connection and inspiration. Remind yourself, I am present here to learn and grow today. Take one more deep breath and welcome to this space of learning.
Swatina, I'm sure that everyone must be feeling relaxed and re-energized. Yes, you all will be experiencing different techniques, relaxing techniques like this every day. So we also look forward for the participation. Let us understand the term health. What do you mean by health? Audience, can you just text in the uh, chat box? What do you mean by health? If you can give your responses in the chat box. Okay, well-being, mental, physical. Health is physical, mental, social well-being. Yes, rightly said. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and it's not just absence of disease. Let's break this down. Thought physical health is all about body fitness. Mental health involves our thoughts and emotions and the ability to handle stress. Social health is about the relationships and connections. For example, a person might be physically fit, but he must be feeling extremely lonely and anxious. Then we cannot say that he is completely healthy. I'll give few more examples separately for physical health, mental health, and social health. A 14-year-old boy have frequent headaches due to unhealthy diet and dehydration during school hours. And mental health example is a girl in class 10 experiences exam anxiety leading to poor concentration and sleep disturbances. And another example for social health issue is a child feeling isolated and left out because the classmates have excluded from group activities due to his or her shy behavior. So I'm sure that everyone here will agree with me that health is not only about physical body, it's also about mental health and social well-being.
Yes. Yes, absolutely. Even I agree with you, Pramila. We can also see this in a bigger picture as a house of health. So, can we do a quick activity? Participants, are you ready for a small activity? Yeah. So we will do a quick activity called House of Health. So I request you all to grab an A4 size sheet and draw your house. Draw your house with all the rooms visible in it. So it should be a house where you can draw your drawing room, bedroom, bathrooms, balcony, kitchen. So make a house where you draw all the different rooms. It can be a rough sketch. Do not worry. We are not expecting any artist here. We are just trying to understand our house of health. Once you have drawn the different rooms, try to think about each room and the emotions that you attach to that particular room. So when you think about kitchen, what are the emotions that you feel? When you think about your bedroom, what are the emotions that you think about? Or what are the emotions that you experience? Take your time. We are giving you 3 minutes for this. I'll repeat this. We are drawing a house with all the rooms in it, including the bathrooms, the bedrooms, the balcony, and the kitchen. Once we are done with the drawing, we try to think about the various emotions that we experience in the different parts of our house. Once you are done, if you can give us the thumbs up, we know we have to go further. Thank you, Mubashira Begum. I request all the others also to give a thumbs up. Hope we are all done with our house of health. Can anyone show their house of health? Can you show the picture that you have drawn? Let me see if I can pin you, ma'am. Am I able to pin you?
Hello. Hello.
Yes. May I know who's this?
I'm from Datnagar.
Meghna. Am I correct?
Yes.
Yeah, Meghna.
This program what?
Meghna, we are not able to hear you.
This program is for what, ma'am?
We are having a webinar on psychological disorders.
Okay.
Yeah.
Hmm.
So can anyone just talk about their house of health? Can we have 2 volunteers here who can talk about their house of health?
Yeah. Shall I?
Yeah. May I
Yeah.
know? This is Kavita
Ah,
Rajman.
yes.
Yeah. Please, Kavita ji.
Actually, my kitchen it is connected with my physical health as well as my mental health. Because when
Okay.
I cook, I think about the members of family, their likes and dislikes, and
Okay.
what is good for body. So physical health I keep in mind.
Okay.
So I connect it to that. And drawing room where we sit and connect. So that is connected to social health.
Hmm.
Puja room, I put it under mental health. So when I
Okay.
sit calm and serene there, I feel boosted.
Okay.
So, and bathroom is physical health,
Okay.
and study physical as well as mental. I'll put.
Okay. Okay.
I feel energized when I complete something,
Mm-hmm.
and it loads my knowledge also.
Yeah.
So, and bedroom is physical as well as mental. I
Yes.
feel rested, and in as a chain, my physical health improves.
Yeah. Yeah. Beautiful connection, Kavita ji. And
Yeah.
beautiful
Thank you.
insight you have on your own house of health. Thank you
Yeah.
so much, Kavita ji.
Thank you.
I can see Shanti ji. She has raised her hand. Can you unmute Shanti ji? Can you speak?
Yes, I'm audible.
Yes, ma'am.
Thank you so much for the data, ma'am. This is the first webinar which I'm attending. Thank you so much, ma'am. I blessed. I not draw the house, but I have given to my mind. But I feel it is a blessed house because the energy level of my grandparents, great grandparents were staying there. Their energies, their pattern of thinking, their social life, and how positive they are together, living together and sharing all the views and what sort of things we can do happily if it is a nuclear family like that. So I got all the such things when I got the house like that. And when I got the area where which we all used to sit together and we used to have a lunch or a dinner. So it is a pleasant moment. I feel, and it I was observing the love which was showing to each other. I feel is a blessed.
Yeah. Thank you. Thank you, ma'am. Thank you for sharing your view. Thank you so much.
Thank you.
Yes. Can we have one more participant who can speak about their emotions attached to the place in their houses, in their house?
May I have?
Hello?
Amrita ji. Am I correct?
Yes, ma'am.
Yeah, Amrita ji, please.
Ma'am, when I look at my home in kitchen, I feel the emotion like love and care for my family.
Hmm.
And in puja room, we can hope for our best for our family or for ourselves, or for we can think for the world also the best. We can hope the best for us. And in
Correct.
drawing room, the emotion I can connect is the celebration, mostly with our family or with our society or with our neighbors. I feel the connection with the different type of celebration we enjoy in our drawing room. And
Yeah.
the bedroom, it brings the intimacy. The emotion is the intimacy which will connect us with our family.
Yeah.
Then the balcony, the emotion I felt, we can connect ourselves with the nature and the outside world, which brings say relaxation, the whole day work or any type of mental relaxation there.
Correct.
And in the bathroom also we connect with the relaxation. The emotion I feel is the relaxation.
Correct.
That's all, ma'am.
Thank you. Thank you so much, Amrita ji. Thank you, Shanti ji. And thank you, Kavita ji, for sharing your views and sharing your insight about your health, house of health. This activity was just to make us understand that it's not about the place, it's about what emotions we attach, it's about our inner self, right? So it's about how we connect to different places. And you would have seen that we all have the same rooms, but then the emotions attached to them are different. It depends from person to person. So I hope this house of health will make you understand which portion of the house you should invest more time in, and which portion of the house you should work on. So this is a beautiful exercise to understand your own emotions connected to the different places in your house. Thank you so much, participants, for participating in this.
Yes, Vatina, wonderful. Actually, most of us will be very conscious about the food we take because it really helps us to take care of our health. But lately, I realized that what we feed in our mind as thoughts are
Correct.
very important for the mental health. and what we feed our tummy is what we are. And
Correct.
this grooming of physical health and mental health will definitely help us to take care of our social health, right?
Correct.
So
Yes,
we have
absolutely.
come into the slide of emotions. Now, emotions. What is the role of emotion in our health? Can you guess, Vatina?
I go through these emotions almost daily, the emojis that I'm seeing.
Yes,
So most
yes,
part of my day is with some or the other emotion.
yes. I'm sure that every one of us are aware, but still we will say, what are the emotions that you can select, which you can say that you can describe the emotion here.
Like the one with the question mark is a confused emotion, and the one with a red face is an angry emotion. Maybe the one with this hand is an excitement, which maybe we are
Okay.
in right now while we are doing
Yes,
our webinar. We are excited to meet
yes,
so many
and then
people. Yeah,
yes, and then we can also see a very happy face there, smiling.
yeah,
Yeah.
yes.
So the emotions play a very, very vital role in our mental health. So let me ask our audience, what, how do you feel today? Can you quickly type? I can see good responses in the chat box. Thank you so very much for being a wonderful participation in this webinar. Can I request audience to just post, how do you feel today? If you're comfortable, you can just type in the box there. Remember that there is no right or wrong feeling. It is just to connect with ourselves. Wow,
I mean,
beautiful. I can
yeah,
see excited, happy, feeling good.
yeah,
Okay, positive, curious, and excited, worried, relaxed. Beautiful. Swatina, can we go to the next slide?
yeah, yeah.
Thank you, audience, for sharing honestly. Being aware of emotions is the first step towards understanding mental health. Someone is scribbling on the screen. Okay. Actual emotion to be mentioned and having emotional awareness is very, very important. So these emotions are very regular and normal that we experience on daily basis, as Swatina, you were also mentioning.
Yes,
So let me tell you, as per the World Health Organization, mental health is a state of well-being in which an individual realizes their own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. This means mental health is not just about the absence of mental illness, but about how well we function, handle life's challenges, maintain relationships, and contribute to the society with a purpose. General mental health issues refer to common emotional, psychological, or behavioral problems that affect how a person thinks, feels, and acts. These may not always qualify as severe psychiatric disorders, but can impact daily functioning, productivity, and relationships if left sorry, if left unaddressed. People may have poor mental health without mental illness, also have difficulty in managing emotions, controlling thoughts, difficulty in solving problems, and maintain healthy social connections. A certain level of elevation in, in these emotions lead to mental health issues. So, Atina, can I request you to go to the next slide? These mental health issues can be addressed with certain interventions and counseling sessions without any need of medication. General mental health includes emotional balance, coping with stress, and maintaining self esteem. For instance, feeling nervous before an exam is very normal, but If someone avoids studying because of fear of failure, that indicates poor coping. We can see the general mental health issues, few examples like stress, tension, not able to control anger, negative thinking, and few more have been listed on the screen. You can have a look at it. When you are able to cope, they become very normal, but when we are not able to cope, they may become as little issues for us.
Yes, and general mental health also influences social relationships, productivity, and balancing the ups and downs of life with resilience. But Pramila, how are these general mental health conditions different from the severe mental health issues?
Yes. Can we go to the next slide?
Yeah, yeah.
Imagine someone fails in an interview. A person with balanced mental health may feel sad and prepare for the next one. A person struggling with mental health issue may feel worthless and give up trying. Severe mental health issues are conditions causing significant disturbance in thinking, emotion, and behavior and often impair daily life. I will give you few more examples, Swatina. An
Hmm.
individual with severe obsessive compulsive disorder, in short we call OCD, may wash their hands hundreds of times a day due to fear of contamination, leading to skin damage and inability to carry out daily tasks like work or studying. A person with schizophrenia may hear voices others cannot hear. Someone with severe depression may find it hard even to get out of bed. A person with severe panic disorder may have frequent panic attacks with intense fear, sweating, chest pain, or dizziness, and may completely avoid leaving home out of fear, having an attack in public.
These maybe they need, not maybe, they really need professional help and require clinical intervention, therapy, and even medication for better management.
Very true. Can we go to the next slide? Examples are there of severe mental health issues,
Yeah.
and these are very much easy for us to find out, understand the symptoms and the severity where the DSM is there to guide us.
What is DSM?
DSM is Diagnostic and Statistical Manual published by
Okay.
American Psychiatric Association. It provides criteria for diagnosing mental disorders worldwide. Another example which we can state is this helps us differentiate between general sadness and clinical depression based on specific criteria like duration and impact on functioning.
Yeah, and I think we also have ICD. ICD is International Classification of Diseases, which is a cross-cultural tool that helps record, study, understand, and compare information about illness and mortality rate in a clear and organized way, even when the data comes from different countries and or times. It makes sure that the recorded data can be clearly understood and used again for many purposes, not just for health statistics, but also for making decisions, planning resources, creating guidelines, and many more.
Yes, in our webinars, we'll be talking about a few psychological disorders from the DSM-5
Hmm?
categories.
Yes.
Swatina, how do you think that these webinars are going to help us?
Of course, these are going to be very helpful. Firstly, it will help us to build awareness about mental health, which is the need of the hour. Many people don't even realize. Just now, I think Geeta ma'am said the same thing. Many people, they suffer and they don't even realize their struggle. They don't understand what they are going through. And that impacts not only their life, their relation, their work, but it also affects the people around them. So it is really going to help us to understand these things through this webinar.
That's so true. Also, by learning to identify early signs, You can guide clients effectively and even help friends or family members when you notice changes in them.
Exactly. Quick intervention can make recovery faster and easier.
Slide. Mental health awareness is not just for psychologists, but for every human being to build a compassionate and strong community. But why do people hesitate to seek mental health help? Why do you think? Can I
Maybe,
ask audience to type in the chat box?
yeah, sure.
Why do people hesitate to seek mental health help? Audience,
We can also see
can I
in the
request?
we
Yes.
can also see in the YouTube live, ma'am. Yeah,
Because
stigma,
of stigma.
awareness.
Because of stigma.
Yeah.
Beautiful responses.
Yeah, even in the live chat, people are messaging, ma'am. Stigma and lack of awareness,
Yes.
hesitation.
Often due to stigma and lack of awareness. Beautiful. And anyone can experience these conditions. Let us watch a video to understand it, and let's hear from a celebrity too. Sotina,
Yeah,
can we have the video?
yeah. I just try that. Yeah. Is it visible, ma'am?
I think the other one. First is the other one.
Okay, just give me a minute. Just give me a minute, ma'am.
Yes.
So I feel like in my journey, my acceptance and the diagnosis was half.
Ma'am, just give me a minute. I need to share it again. I'm so sorry. I think this one we wanted to show first.
ఈ ఐడియా సాధ్యం కాదు.
నా ఆర్మోస్ అన్ని అమ్ముడుపోతాయి.
Ma'am, is it audible?
Yeah, it's audible. You can maximize that. Yes.
So, thanks to Radio City, we got this information from this channel, and it's really like surprising to know that these people who are maybe inspiration, inspiration icon for thousands and lakhs of people, they themselves have gone through this. So really, like we need to understand that we have to destigmatize this whole thing about mental health, right, Pramila ma'am?
Yes, Swatina, very true. Shall we also listen to
Yeah,
Deepika
yeah,
Padukone? Yeah.
yeah. I'll do that. I'm just trying, ma'am. Just give me a minute. Sorry for the glitch.
No, if I can help you, Swatina, you kept the window open. You can just minimize this and click on that window.
Yeah. Thank you. Yeah. Ma'am, is this visible now?
No, I think, yes, now it is.
And the diagnosis was half the battle won. My life changed after that. I'm not here endorsing medication. I think it's important for everyone to find what that is for them, that works for them. I've had to make lifestyle changes. So whether it's sleep, whether it's nutrition, whether it's exercise, mindfulness, all of these things, and just focusing on also human interaction. Yep. There are moments sometimes where I feel like it's coming back. But I think the good thing is that today I'm more equipped and I understand, I can feel it coming on. And so I don't allow it to get to a place where I might slip and go back into that dark space again. The trickiest time for me, like I said, was not knowing what I was going through. And all I wanted to do when I went public with my illness was to state out the symptoms and say to somebody that this is what I felt, and if you are feeling like this is probably what you're going through and experiencing, and you might need to seek professional help. Because I didn't want one single person to go through the journey of the unknown, which I had gone through. I think we need to, at least for the next 1 year, focus on destigmatizing and creating awareness. The funding is important. I think the data is important. I think research is important. I think localization and understanding every culture differently. But none of this will be successful if we're not able to destigmatize mental illness and if we're not able to create awareness about the importance of mental health.
And I think we are exactly trying to do the same. Isn't it, ma'am?
Yes, very true.
So we hope that the audience here has understood the aim of this webinar, but then we will definitely try to take you through the takeaways. So this webinar is going to give you all the diagnostic criterias, the key symptoms, and the treatment options for the major severe or the severe mental health conditions. And as we have already listed the dates, and the timing. We just hope you all are there with us in this journey, in this 21 days of journey, and journey of 21 days, where we try to understand, we interact, and know more about them, and really destigmatize this whole situation. So, through this series of webinar, let us contribute our bit by discussing, spreading awareness, and supporting each other. Let's handhold the ones who step forward to seek help.
So to bring in this awareness of mental health issues, we will introduce you with brief criteria, symptoms, and mention the treatments to build your foundational understanding. For each category, we will mention the diagnostic criteria briefly, the common symptoms, and general treatment approaches. So, audience, keep your minds active and feel free to participate. Learning is best when it is fun and reflective.
So, what do we need? It's call to action. We request you all to invite as many people as possible, be it students of psychology, be it the community of counselors and caretakers, mental health caretakers, or anyone for that matter. We just request you to spread a word among them about this webinars, and let us make this a huge success so that we can spread awareness and build a healthier society which is more empathetic and helps us to prioritize mental health and remove the stigma. Let us remember
Being
being
yourself,
yourself.
yes,
Man, go ahead.
being yourself is more than enough.
Don't believe everything you think.
Take care of yourself is essential. Taking care of yourself is essential.
Stop and take a few deep breaths.
You have got what it takes.
Better days are coming. So, together we can build a society where mental health is valued as much as physical and social health.
Now we keep the question and answer session open. Audience, if you have any questions, kindly either type in the chat box or you can raise your hand or unmute and you can ask any question if you have. Swatina, as Geetha ma'am suggested, can we also look at the live questions
Yes,
if
ma'am.
there are any?
Yes, ma'am, I'm doing that. I'm just waiting for the questions. Audience, any questions? You can please raise your hand, unmute yourself and speak, please.
Yes. We request Geetha ma'am, if you're available, can I read few questions? Yes,
Yes,
Vijayalakshmi. Yeah.
yeah, I'm there.
Ma'am, there is one question. OCD can cure completely.
Can you repeat the question again?
I'm thinking that it is a question only. Can OCD cure completely?
See, basically for mental health issues, it's not like curing, it is management. It will be under
लगाते
control.
हैं स्टोर खींचने का अभी जाके लगा पट्टी बांध के इसमें गरम
Yes, ma'am.
So I muted all of you, all the participants. So I want Pramila to unmute, and anybody want to ask question, let them raise the hand and you will unmute. Okay?
Okay. Sure.
So it is management, it is not like cure.
There is another question, ma'am. Due to fear of failure, as I failed in BTech and could not cope up in hostile environment in those days, I'm not willing to pursue MTech. Any solution?
Is it because of fear of failure?
Yes, ma'am. That's what is mentioned.
So because of fear of failure, not ready to go for higher studies. Am I right?
Yes.
So here I want, I don't know the person name, but I want him to check whether how strong is the desire compared to the fear of failure. So when your willingness to pursue or the strong desire is there, fear of failure is something which you can work on. So you are the creator of your fear, you can break it. But there is a therapy process. Basically, for generally fears, we have cognitive behavior therapy, which helps.
Another question, ma'am. Will the techniques also be covered for depression due to loss of loved ones?
That is called trauma therapy. When there is death of a family member or a huge financial loss or an abuse or there is childhood trauma, all this we generally use trauma therapy. DBT is generally used for this. There is a therapy. There are people who are specifically trained in trauma therapy.
Thank you, ma'am.
Not normal
you-
general techniques will help.
Okay.
Mhm.
Can you give some idea for management of OCD?
Mhm. See, as I said, OCD itself is a complex issue. We are coming up with a webinar specifically on CBR or OCD. Just stay tuned so that you will understand OCD better.
Thank you, ma'am.
Good job. So if you're done with the questions, then
We have few more, ma'am. Can we take up?
Yes.
Yes, Vatina, can you take up?
Yeah, ma'am. In YouTube, there I am not seeing any questions yet, but here I would like to ask. Just a minute, ma'am.
Adjustment issues between family members.
Okay. There's a question, ma'am, that says adjustment issues between family members making big havoc in family. Tips to establish harmony. Are there any tips
So,
to establish harmony?
yes, why not? See, the relationships are always beautiful, but we strain them or we actually, push them into these sort of situations, conflicting situations. So there is a beautiful therapy for relationship building. So we are always, there to help. Therapists are there who are well trained in relationship therapy. Okay.
Okay, ma'am. Yeah. Ma'am, next question we have. How can a panic attack be pacified or resolved?
As I said, there is no resolving something, but panic attacks can be wonderfully. The client can get the panic attacks into control because we have experience of a client who has this panic attacks within minutes, and the impact was so huge. But then, after therapy today, she's able to manage her panic attack, and she's able to actually her panic attack was in the bus. She used to get it in the bus because of some past trauma in the bus. So today she's able to travel, she's able to manage the panic attacks.
Okay. Okay.
They look like very life threatening. Panic attack actually look like life threatening, but then it can be under control. We can work with it. We have already successfully worked.
Okay, ma'am. Ma'am, there is a question regarding the fee for Sahaya.
Yeah,
Vijayalakshmi ma'am have
definitely.
replied. Yes.
Okay. Okay.
Yes.
They can contact us personally, and you can share the link, the WhatsApp group link. They can come and join there for more details.
Ma'am, there is one more question. If a person is out of depression at early age and recovered from it, is there a chance that they go back into depression again?
Yes, that is called relapse. So relapse is always there in for all the mental health issues. So you should be very careful, and you should be alert about the triggers. That's why we mentioned this as triggers and treatment. So you should be careful about your treatment plan and also triggers. And relapse is always there.
The next question. I think the question means trauma therapy given by psychologist or some other therapist. Maybe they are inquiring whether this therapy is given by
I'll tell you.
psychologist.
I'll tell you. I'll tell you. See, trauma therapists are psychologists only. So, but they are specifically have a training in trauma management. So they are psychologists, but trained in trauma therapy.
Okay, ma'am. Ma'am, I can see one last question. How
Hmm.
can we manage mood swings in kids of 15 years? Even I would like to know this, ma'am.
That's a good question. So again, I would like to tell you that we are having a specific webinar on childhood disorders. So we are covering this, behavior issues also there. So Nilofer and Nitya will be there to answer your questions.
Thank you, ma'am. Thank you
Right.
for your.
Okay.
Thank
So
you so much, ma'am.
if they have
All the
questions, they can post in the group. We can answer them in between the webinars also. Thank you.
Yeah, yeah.
Thank you. Thank
So,
you, ma'am.
audience, the WhatsApp group is open. You can post your questions there. Yeah. So, ma'am, can we move ahead?
Yes.
Yeah, we are almost at the end.
So
So,
let's,
but then thanking is a major part. So,
yes,
Pramila, ma'am,
yes.
please. Yeah.
Let's end the session with an affirmation together. Repeat silently. I value my mental health and will use this awareness to support myself and others with empathy. Thank you all for joining. Stay aware, stay grounded, and keep growing. We look forward to connecting with you again tomorrow and for next few days. Thank you all once again.
Yeah. So, before the last bye-bye for today, let me just give you a brief of tomorrow's webinar. Tomorrow we have webinar, which is day 2 on general anxiety disorder, GAD. This will be presented by our counselor, B. Manikishore Reddy and Dr. Swati Petram under the able guidance of Dr. Geetha Challa and B. Vijayalakshmi. So we hope to meet you all tomorrow sharp at 5:30, and all the requirements and other details will be posted in the group. Stay tuned to the group for further updates. Thank you so much for giving all your time and patience. Thank you, Geetha ma'am. Thank you, Vijaya ma'am. Thank you, all the lovely audience. And we just expect we have more and more people in the upcoming webinars. Thank you so much.